Okay, thank you so much for doing this. Can you tell us your name?
Yes, no problem. Thank you for having me. And my name is Shydai M.
What are your credentials?
So I am an LPN of 5 years, and I recently completed my BSN, my bachelor's degree in science of nursing, and I'm currently awaiting taking my NCLEX.
Congratulations.
No problem.
What is your specialty going to be?
It's going to be surgical ICU. I'm very excited. I just got hired as a new grad resident in the surgical ICU.
And how do you describe your specialty?
So the surgical ICU sees a lot of different patients. It depends on the type of hospital, whether it's a trauma center, it's not a trauma center, and also what other types of ICU kind of delegates what you see in this ICU. So at this particular hospital, we don't have like a separate trauma ICU, nor do we have a neuro ICU. So we'll see patients that may have like head injuries will come to the surgical ICU, where someone who comes in with like stroke symptoms will go to the medical ICU. We also often see, obviously, postoperative complications. We'll see GI bleeds, things like that.
How long have you been in healthcare?
I've been in healthcare for quite a long time. I would say about 9 years in total.
What jobs did you do before nursing?
So before nursing, I started out as a CNA. I spent maybe like a year and a half as a CNA. And then I was a medical assistant for about 4 years. And then for the past 5 years, I've been a licensed practical nurse.
What jobs did you do before nursing?
Before nursing, I worked in retail. I was a cashier.
And what jobs or skills helped you the most in your nursing career?
The ability to critically think and customer service. Your patients are coming to you for various different reasons. If you have a strong set of customer service skills and just hearing them out and listening to what their issue is and kind of working with them, while also serving up good, smiles and just being positive with your interactions, it can really positively affect your patient.
What or who motivated you to go into nursing?
As a kid, this is going to sound crazy, but I was very clumsy as a child. I remember like I sliced off part of my finger when I was like 4, playing around. I broke an arm. I had a bunch of stitches, and I was always in the emergency room in the Bronx, Albert Einstein Hospital. And I just remember like, I used to always be really freaked out, and I would feel reassured by how the nurses and stuff would care for me. And I would feel a lot better. So I feel like at an early age, that kind of like affected how I looked at healthcare. And I knew I wanted to be able to provide that to someone else.
Did you consider any other role in healthcare?
Slightly. So at one particular point in time, I was considering doing like ultrasound sonography, but I felt like it's very limited in what you can do. And I really wanted to have a career in healthcare that was much more like general, and you can do so much with it.
Mm. How do you respond to the question, why didn't you become a doctor?
Because doctors treat diseases and medical issues, nurses treat patients. We are truly the heart of, the patient's care, and we're with them most of the time. So I feel like just with my personality type and what I want to do, it definitely aligns more so with the nursing process as opposed to the medical process. Both wonderful fields, of course, and much respect to physicians.
Oh, most definitely. What do you want the public to know about nurses?
I want the public to know that nursing is not one size fits all. You can do so much with your nursing license. You can be a nurse and never directly interact with a patient, and that's totally fine. You can be a forensic nurse, you can do case management, you can do nursing informatics. It's not one size fits all, as not every nurse needs to enjoy working in one specific area. You can have a complete aversion to dealing with one type of thing and still function as a nurse. And I want the public to know that nurses work hard. It's not just a matter of pushing pills and cleaning people or just something like that. We do a lot. There's a lot of science behind nursing, and it's a field that definitely demands respect.
What did you wish you knew before you went to nursing school?
I wish I knew how much science would be involved in your journey of getting your bachelor's. And I would have done a little bit more in high school to prepare myself. I took a break, and I'm an adult learner. I went back to school a little bit later, like in my mid-20s. But I wish I would have just kind of like really paid attention and did a lot better with things like chemistry, biochem, things like that. I always had a strong foundation in anatomy and physiology, but some of those other sciences, patho that you don't really think about so much is imperative for your nursing education.
Where did you go to school?
So do I say the specific school? I can, I don't mind.
Yeah, it's up to you.
Okay, sorry. So I went to Long Island University.
Oh, okay. Is that it?
I went to Long Island University Post. There's two LIUs. There's LIU Brooklyn and LIU Post. LIU Post is the Long Island location in Brookville, New York. Go
And
Sharks.
what about when you were CNA and LPN?
For my CNA, I completed that through my high school. There was like this vocational thing that we did. I graduated high school in 2013. There was like this vocational program where you got like science credits and you kind of graduated with your CNA certification. You sat for like the state exam. Forgot what it was called. It was a vocational school upstate. And there was a vocational school I also went to for my LPN license. I think they may have closed. It was called Southern Westchester BOCES.
What is vocational school?
A vocational school, also called a trade school, is like an alternative to going to a college, right? It's where you pick up a trade. You can do multiple different modalities, whether it's like you want to do welding, you want to do glassware, you want cosmetology. It's like a shortened certification only kind of school where you're not getting a degree, but you're getting education for like a professional license or certification.
Thank you. Did you shadow anyone before pursuing nursing or your specialty?
Did I shadow anyone? So I guess, yes, I kind of did. So with my particular specialty, the surgical ICU, a lot of different BSN programs have this thing called capstone, which is your final clinical rotation that you do in your very final semester of school. And it's not like your other clinical rotations where it's normally like maybe 6 of you, 8 of you, and a clinical instructor. It's literally 1 of you, and you follow the schedule of a specific nurse that the school kind of vetted and, the institution vetted, and you follow their schedule, whether it's days, nights, and it's various different type of specialties. And you just kind of get selected based on your preference, based on what's available. It's a very important clinical rotation to be a part of. And I actually got, my school selected me, and I went to the surgical ICU at a different hospital. So I was also in the SICU there as well. And like, I always knew I wanted to do adult, intensive care, 100%. I always knew I wanted to either be in the MICU or, the CVICU or the neuro ICU. I knew I wanted ICU. I just didn't really understand the differences between the types. So getting the opportunity to do my capstone in the surgical ICU was great because I love the disease process. I love utilizing some of the critical care devices like CRRT, central lines, A lines. Like, it was a great experience. And that really was like, okay, this is the ICU for me. Like, it makes sense.
What motivated you to advance your education?
I feel like I knew I wanted to go back to school to get my RN license, like throughout the entire time of getting my LPN. I wasn't as competitive of an applicant at that particular point in time. I had an associate's degree in humanities, and I just wasn't as competitive as an applicant as I ultimately was when I finally got accepted into the bachelor's program that I was in. But the pandemic was definitely like something where I felt, I worked in a clinic. I was in an internal medicine clinic at a doctor's office as an LPN for a couple years. And that's where I was when I started applying to, RN school. And I felt like I wanted to do more. I respected so much at the beginning of the pandemic how there were nurses in the hospital, RNs, there were physician assistants, doctors, there were just, respiratory therapists. It was so many different modalities in the hospital dealing with these acutely sick patients in these settings. And I learned about proning, just from like watching videos explaining some of the things they would do. And I just was so inspired. And I said, I think this is the push I needed. I'm going to like finish these online classes, like these prereqs I have to retake, and I'm going to apply. And I did. I applied to a couple different schools, the like middle of 2020 during the pandemic.
Wow.
Yeah.
Did you receive any financial support or tuition reimbursement?
No. I I actually won a scholarship. Like it was a smaller scholarship through like a private organization within the state. I think I maybe received like $1,000 from that scholarship. And then I also won like $2,000 or $3,000 scholarship for writing an essay at my school from like, they have this donor kind of scholarship, but it's through the school itself. The first scholarship I received, the external one, was during my sophomore year. And then the spring of my junior year, I got it's called the Hutton House Scholarship.
So did you have any student loans?
Do I? My loans are in deferment right now, but yes, I took out loans, which covered about half. Half of it I would do like a payment plan, and half of it would be loans. I didn't qualify for like TAP and Pell. I'm from New York, so I'm not sure if all states get. I think it's TAP. I think everyone gets Pell or something of the sort, but I didn't qualify for both of those anymore because I have an associate's degree and I also went to a vocational school, so I like maxed out all the grants that you get for financial aid.
And your strategy for paying those loans back?
So the strategy for paying the loans back is just paying them. You know what I mean? Just paying obviously more than a minimum. I'm getting a decent amount in salary from this job, which I'm very excited about. So I'm just gonna pay it and do what I can.
Advice for nursing students in clinical rotation and orientation.
So the advice for nursing students and clinical rotation and orientation and everything is to understand that you don't know everything and your job is to sit there and be a sponge. I went to a traditional BSN program as an LPN with years of experience, and that was purposefully. I would barely tell anyone except for maybe students that I was really close with that, I have my LPN license. I purposely wouldn't say that because at the end of the day, this is everyone's first time being an RN student, right? And you're there to learn. I would see certain classmates that would kind of try to correct either clinical instructors or try to correct nurses that we were there observing. And they would say things like, I already work in a hospital. This is how it's done on mine. Or I work as a CNA and this is how we do it. And just would kind of stick their neck out. And I would look at that. So just, it was not a good thing to do. And I feel like just don't ever be that student. Be respectful of the facility because you're a guest. And no matter how you perceive things to be, like, it's a blessing that they're letting you in their institution, and maintain contact with your clinical instructors. They will help you out so much. And it's more than just, okay, like if you have questions, like sometimes they'll help you like with certain topics to go over, or just like give you kind of like, hey, maybe you want to check this website out. They have some good notes or some good like practice questions. Like it's more than that. Like I had a clinical instructor write me a recommendation, and some of them will help you get jobs and things like that. So I think that's a big thing to do.
What's one thing you think students should know about nursing that's not taught in nursing school?
Nursing is not one size fits all. And like I said before, you can do so much with your nursing license. But just know that like you're going to be learning forever. Like nursing, healthcare, medicine is constantly changing. Once you get your RN license, like your learning is not done. And another thing too is like nursing school is half the journey to becoming an RN, right? The other half of the journey is passing your boards. I feel like my school did a great job, and I appreciate that for them, like preparing us for NCLEX. Like they had a lot of things that they would help us with as far as like, hey guys, like, this is a review, this is the days we have it. There's a lot of things like that, but not all schools do that. So I just wish that all nursing schools would kind of stress the importance of like, okay, like, in the winter before your final semester, like start looking at NCLEX questions, start getting ready. Like the NCLEX is a monster.
What, if any, changes would you make about nursing education and training?
Nursing education and training. I feel that there should be more incentives to push people into nursing education. The country as a whole needs more nursing educators. And I feel that like there should be certain states have it, and I know that for sure. There should be more opportunities for like scholarships and grants and things like that for people pursuing masters in nursing education. I feel like that should be a degree that institutions should offer for free. because we need so many nurse educators. So I think that just pushing people to pursue nursing education is something that should be, you know, done, because we need nurse educators. We need nurse educators to bring on more nurses to teach them and help them, take care of people.
Wow, I was not expecting that answer. I love that.
Thank you.
When and how did you get your first mentor?
My first mentor, just maintaining a connection with a clinical instructor I had, and just kind of like bouncing ideas. But then again, there's someone that I work with that's a registered nurse that I really look up to, and she's like the best. I work in an urgent care Well, I worked in an urgent care as of like, a week ago I resigned and everything because I'm starting my new job on Monday. But for the past like almost 3 years, she's an RN and she's been giving me tips. She's been just kind of like a really bright light as far as teaching me some of the tactics and how to assess patients. And when she would have patients that would become more unstable, she'd say, Shydai, come, let's do it together. Let me show you. And I really appreciate her for that. You know what I mean? She kind of looked at me as an RN throughout my nursing education journey. And she's been great as far as just like teaching me and explaining things to me and explaining how the process for her studying for NCLEX was. So I love her to death. Mo, you're the best.
Shout out to Mo.
Shout out to Mo.
So this is perfect then. Advice for how mentees can add value to the mentor-mentee relationship.
Mentees can add value by showing appreciation and respect. Any little thing that the person does, your mentor or a person that you look up to in a mentor way that kind of like sticks their neck out, you just let them know how much you appreciate it. Certain times people just instinctively, people that have that kind of like teaching, like nurture kind of aspect will kind of take you on and kind of teach you things just instinctually. I feel that when they do even the smallest little gesture, just let them know like, hey, this is how I feel about that. Or, hey, what you mentioned the other day, we actually saw it in clinical. Thank you so much. I feel it's important to kind of let them know that they're appreciated and what they've done is kind of like helping you with your process. So just give grace and show thanks to them.
What attracted you the most to critical care?
Critical care, as I mentioned before, the pandemic was something that kind of was like, I would love to be a part of that. And I saw some of the cool things they were doing. I like to be able to think on my toes, and you can do that with any area of nursing. But I just love in critical care how you focus on every single system of the body and you do these complex assessments, and it's a lot of complex devices. And I just feel like it's a great opportunity to really exercise my brain and see these different disease processes that you read about in the textbooks that you don't necessarily see on an everyday basis, and like, a regular floor or even in the ER in some cases. So I just thought that it was perfect for me and how I like to learn and how I like to practice.
What changes are taking place in your specialty as it relates to clinical practice and research?
This is something that at this particular point in my career, I can't necessarily answer as a novice CQ nurse, right? I haven't had enough experience to really see the trends and see how they've changed based on like evidence-based practice and stuff, but we'll circle back to this.
Well, we are gonna hold you to that invitation. Do you have any particular research interests?
So there was a Peacock question I actually wrote in my research class this final semester that was something I think is important to research, and doing my research for this paper, it was like a really interesting topic that kind of was something I think is really neat. So the question I proposed was, if I'm not mistaken, it was how does like remote monitoring and telemed of blood pressure, how does that affect blood pressure trends and compliance to blood pressure medication over a 6-month period? And I feel like in 2024, the utilization of telemed and remote monitoring and things that kind of get sent directly to your doctor's office, I wonder if that kind of holds patients more so accountable to like being compliant with medication administration, diets, things like that. So that's something that's really interesting to me, just to kind of see how modern technology can help, patients stick to the routine and how it can ultimately affect their health status.
What deterred you from some other specialties?
So there's one thing that like I I think it's great, but it's just definitely not for me. I always knew this without question is I cannot work with peds. It's just not for me. I have pediatric patients that will come into the urgent care, and that's great. But I just know that it's so funny. It's like in school, like 90% of my cohort was like, I want to work with peds. I want to work with kids. And I was always like, absolutely not. So that was something that deterred me without question from like pediatric areas and the ER as well, because most ERs you do see pediatric patients. And also like I like to kind of know, generally speaking, like what the person is, you know what I mean? Kind of like being seen for what is their admitting diagnosis, right? So the nature of the ER is that, you know, you're kind of trying to connect the dots and understand what the main issue is, stabilize them and ship them off. That's something that kind of deterred me again from the ER as well. Those are the main areas where I just was like, those don't necessarily mesh well with my interests. I could see myself working in the PACU at some point in time or oncology though.
If you weren't in nursing, what would you do?
If I keep thinking about this question, I really do. And it's so funny. Like, I don't know, in 2024, like, I think I would go into something to do with computer sciences, cybersecurity, or something like that, something along those lines.
How much longer do you think you'll practice?
A long time. I'm like a baby as far as an RN goes, right? I'm brand new, so I know I have quite a long time as far as my career goes ahead of me. But I definitely, without question, know I'm going back to school. And the next like 1 to 2 years is really gonna kind of determine what that looks like. Because I'm like back and forth where I feel like although I'm a brand new RN, I've been in healthcare for a while. So that kind of like shapes my interest a little bit, because I'm not a new nurse, I'm a new RN, right? So that's important because I've been an LPN for a couple years. So like I'm not sure if I want to go the route of nursing education, and that's why I mentioned that before, because that's actually something that I was considering going back to school for, to be a nurse educator, or if I wanted to go back to school to pursue adult gerontology primary care. But the next like year or two will kind of be something that kind of like guides me a little bit more. But you know, I feel like you got to keep it going while it's fresh, and you know, I definitely want to get that higher like education degree. I want to get that master's, if not doctorate.
We're going to be talking after this interview. What should someone who's considering nursing do to prepare right now?
To prepare right now, you want to look at you want to look at some schools, right? Let's say you live in New York and you want to look at some, you know, State University of New York, which are state schools, or City University of New York, which are city schools, which is like specific to the 5 boroughs. You want to kind of figure out what some of their prerequisites are. If you can, I say go to a state school, and I'm saying that for a reason. I went to a private institution and I'm going to be in debt for a little bit from it. Look at some of these schools that, you know, are state run, and see if they have a waiting list, because a lot of them do, because they're reasonable and, you know, everyone wants that. If they don't, okay, that's great. Look and see what their prerequisites are as far as classes go and what their application deadline is. And even if it's just like, okay, you know, there's a wait list and I know I can't start it right now, even if you just say, okay, you know what, over the summer, I'm going to take Psych 101, or I'm going to take English 1, or, you know what I mean? Like, just start the process. It's never too late or too soon. Just get it going. And the first step is always the hardest. So I say, see where you're at. And if you have another degree in a different field, look for different programs that have like accelerated programs for people that possess a bachelor's in different fields as well.
Excellent. What's your relationship advice for students and clinicians?
The relationship advice I would give is, don't try to date when you're in school. If you're already in a committed relationship and that's already established prior to you starting the process of going back to school or starting a new job or really trying to get and figure out yourself, then that's one thing. It's good to have emotional support from a partner, But as far as like trying to date somebody, trying to get someone brand new to assimilate into you, trying to figure out your path, I think that that's something you should be wary of.
I kind of agree with you.
Mm-hmm.
How
you
is your
yourself and kind of get yourself ready before you can kind of jump and start something new to take your attention away from your path?
Exactly. How has your experience in nursing changed the way you see the world?
My experience in nursing changes the way I see the world, where I just feel like there's so many things I wasn't aware of that come up as like an ethical issue that I'm aware of because I'm a nurse. Case in point, I didn't know how high the maternal mortality rate of African American women were in this country with the giving birth, right? I didn't know that, and I've been a Black woman for 29 years of my life, right? I had no idea just how high the percentage is in this country, and it's pretty sad that in a developed country like the United States, we have such a high rate of, maternal death and just bad outcomes with Black women giving birth in this country, and that's something that I had no idea about. I mean, you start to hear it now more so in the media in the past like couple years, but I knew about it beforehand and I was just like, wow, you know what I mean? So I feel like things like that and just the disparity and how certain groups of people are treated health-wise compared to other groups, it's something that I've seen, and it's disheartening. And like it I want to be the change. Like I can't change that obviously, but I just want every single patient, no matter where they are, to be treated. Sorry, of course my computer is like doing something crazy. To be treated with respect and dignity, and no patient is less important than the other. And I just wish that, healthcare. Why is my screen doing this? I'm so sorry.
We can see you.
You can see me? Okay.
Mm-hmm.
Sorry about
And
that.
hear you.
Okay. So no patient is less important than the other. Everyone needs to be treated with respect and dignity, and everyone should be afforded the same opportunities, basically. And I feel like working in healthcare, I've seen where certain people don't get that, and it's sad.
Okay, so piggybacking off of that, what's your perspective about the current state of healthcare?
The current state of healthcare, I feel, can definitely be improved. Health literacy is important. And I feel like to do better is to know better. And I just feel that everyone should receive just the basics. You know what I mean? Like explaining the importance of blood pressure and the importance of a healthy diet, exercise, things like that. I feel that the focus should be on primary prevention and just kind of educating and getting everyone aware of these things before they become an issue. And we can't assume that everyone knows everything about how to, you know what I mean? Or like, what are some foods that a diabetic should avoid? What are some, like, just little things. I feel like the country should do a better job of raising health literacy.
Okay, so we have the country and we have you. What's one thing you would change about healthcare?
The thing I would change about healthcare is, like me, I do this in my everyday practice. Anytime I'm doing anything to a patient, and I've always been taught this, like as a CNA, like going back like almost 10 years ago. Anytime I'm doing anything at all with a patient, I explain it and I say what I'm doing as I'm doing it. And certain patients, they'll say like, I know, or you don't need to tell me. And I'm like, oh no, I'm sorry. It's just, force of habit. It just makes it more routine for me. And there are patients who appreciate that. And they're like, oh, that's what that does. Thank you so much for telling me. So I just feel like keeping patients abreast and letting them know, like, okay, I'm going to check your blood pressure. Like, I don't like to startle people. So certain people related to culture or just past experience, touch is something that can be very triggering to people. So even if it's just like, hey, I'm going to check your blood pressure, like I'll say it. And I kind of feel like just explaining what you're doing and keeping your patient actively involved in their care, even if it's just a subtle thing as far as doing vital signs, that has a big impact. So I try to talk to my patients and connect them and let them know what's going on so that they feel like they're like, present in their care.
Wonderful. Is healthcare a right or a privilege?
Healthcare is a right. I feel it should be a right. At times, just with how certain, people are treated in this country, it feels like a privilege. As far as having the same access to care and the same level of care, it feels more like a privilege at times, but I feel like it absolutely should be a right. I feel like everyone should have the same access to the same resources.
How do you obtain your continuing education credits?
I haven't encountered that yet. This is going to be the first time I'm getting my RN license. I mean, I've done things in the past, like to maintain like my CEUs for like my LPN, and it's just like I'll do like an online class or something, or like, you know, do like infection control, like online. But that's the main thing. Just like look online. A lot of them are offered for free, or if your employer has like something and it's like, you know, continued education credits offered, like do it. Even if it's like, okay, I don't need to recertify for a couple months. Those are often good for a long time. So just do it, get it out the way. It keeps you updated knowledge wise, and you could just kind of like utilize it when you need to.
What do you do for professional development?
For professional development, sorry, I'm just turning on my AC. It's getting hot in here. So for professional development, I like to attend like seminars virtually. I like to read like evidence-based practice articles. I'm a member of a couple of professional organizations, and I often get like journals and stuff sent to me, and I'll like peek and kind of skim through those and kind of see like some of the trends.
Oh, which organizations?
So I'm a member of Sigma Theta Tau, and within Sigma Theta Tau, it's the International Nurse Honor Society. There's different like subgroups you can join, right? So you kind of look at some of the journals that are posted there. And I'm also a member of the American Association of Critical Care Nurses, I believe is what it's called.
Mm-hmm.
And they also post a lot of journals about evidence-based practice and things of that sort as well on there.
Excellent. What does networking look like for you?
Networking looks like finding people that share common interests or work in areas that you're interested in, and just kind of like introducing yourself, sticking your neck out and just saying, hey, how you doing? My name is Shydai, you know, like, and just kind of letting them know what you have, and they let you know what they have, and exchanging information. I recently made a LinkedIn page like within the last year, and I think that everyone in a professional sense needs to have a LinkedIn page. I'm like a big proponent of LinkedIn now. I feel like that is the biggest networking tool there is in 2024. You're able to connect with prospective schools, prospective employers, recruiters, colleagues. It makes networking so easy and seamless. So that's a big tool that I utilize now, and that's how I found you guys. I love LinkedIn.
They're gonna think I paid you to say that.
No, I swear to God, LinkedIn didn't pay me either.
Not yet. Where did you learn how to negotiate?
So my mom, my mom instilled in me just know your worth and know what you're willing to accept. And sometimes you turn down offers if you don't feel like they're valuing you where you need to be valued at. She's always taught me that. Like, if you feel like they're not going to value you, then turn an offer down or counter that offer. You know your worth, and that goes into like negotiating, right? So just know your worth, stick to your guns, and focus on what you expect. Don't let a prospective employer or just whomever try to kind of change your opinion on your worth, because you know your worth.
How, if at all, has your nurse or how at all your nursing practice affected your relationships?
My nursing practice and my relationships. I try to keep my personal and my professional life in that regard kind of separate. So I haven't really noticed any like major, you know what I mean? And like I said, I don't believe in like actively dating while you're trying to pursue like school, right? Case in point, if I wasn't in a serious relationship prior to me starting school, I'm not going to start one or really focus on that while I'm starting the process of school. So I haven't per se noticed any major issues. And even in the past, like I try to keep those worlds separate.
How many hours per week will you work?
So I'm pretty sure it's going to be like 36, and possibly it's going to be 312s and then like a weekend. But I got to kind of figure out after orientation how the weekend is going to get figured out. The weekend day is going to get figured out. I'm going to be on night, so I'm going to be 7P to 7A. So
shout out to night nurses.
Yes. Yes.
On average, how many patients will you see in a day?
So in the ICU, in most ICUs, usually there is a like cap at 2. It could be 1, 2, or in some rare instances 3. It just depends, but most of the time it's 1 to 2. So I can expect to see 1 to 2, most likely probably 2 early on in the process, because if you're on a 1-to-1, that patient is extremely, extremely ill. And the surgical ICU, I got to double check the policy, but I know, for instance, like if this was the CV ICU, right? That patient may be on ECMO if you have a 1-to-1. And I know the place where I did my capstone, that surgical ICU, if you had a patient that was on CVP or CRRT, you were on a 1-to-1, right? Because you're essentially, it's almost like dialysis where you're kind of like, flushing out the kidneys, it's functioning as their kidneys externally, and you have to know how to change the settings and kind of change the fluids, and it takes a lot that goes into it. So most of the time I would probably be with 2. They're not going to have a newer resident nurse on a patient that has, renal replacement therapy, that's, intubated, sedated on a vent with all these things initially. But I could say 1 to 2 would be the common.
What's a nurse residency?
So a nurse residency, it's also called a fellowship. It just depends. And it's basically an option for a new grad to get hired into an area where they typically wouldn't, into like more specialized areas. And the thing that kind of makes it interesting is that you have certain days where you're doing didactic classroom, where it's almost like you're continuing school, right? They're explaining how to take care of these patients and how to use these devices. And then you kind of go onto the floor. So it's like a back and forth, like certain days classroom, certain days floor, certain days classroom, certain days floor. And you're also paired with a mentor that kind of helps guide you throughout the process. And usually there's like a evidence-based practice study or a research project that's tied into it. Usually institutions get reimbursed from doing these. So if there's a residency, there's like specific organizations for like, magnet status and things like that for having these residencies and fellowships. So it's like a win-win for both. It's a win-win for the institution where they obtain these certification grants and, they can retain high value nurses that are, able to function in these specialized areas. And obviously for a new grad, it's a great opportunity to go into a specialty that typically would require at least 2 years of experience in med surg, or, you know what I mean? Like it's a great opportunity.
For someone who's transitioning from LPN to RN, what has your typical day look like for the last 6 months?
The last 6 months was my final semester of my BSN program. And it was tricky. It was tricky in the sense that, like, these last semesters, class-wise, I was taking like a research class, and I was taking a class to prepare us for NCLEX while simultaneously working full-time at an urgent care. The work-life balance was tricky, but it was sort of less trickier because I was taking less credits because I'm almost done with my program at that point. But it can be tricky. As an LPN, again, like, you're a nurse, you took the NCLEX already. You just are more so taking care of more stabilized patients in certain settings, right? You're not going to see an LPN in an emergency room in most states, right? You might see them in like a clinic or in a long-term care or like an assisted living, or if they are in a hospital, they're in like a med surg floor with very stable patients. So just kind of transitioning out of that role and kind of starting to change my mindset, especially since I'm in the hospital on my capstones at night, in the SICU, like it was almost like it felt kind of conflicted in some ways, where it's like, okay, I'm dealing with these unstable patients and I'm wearing this cap of being like a RN student about to graduate in the surgical ICU. And then it's like, okay, during the day on these days, I'm wearing the cap of, okay, I'm a licensed practical nurse. I got to escalate these things to the charge nurse. I can't, this patient needs IV fluids, but then they also need IV antibiotics. Okay, I got to go tap in the charge nurse because now in the cap of like being a LPN, I can't touch this, but as a student, I can. It's interesting. It's like a conflict almost.
As an LPN in urgent care, how much time did you spend charting?
Not that much, honestly, because it's an ambulatory setting. So like the things you would chart would be like, if you give like, I don't know, I am ceftriaxone, right? You would write the lot number, you would write the site, the patient tolerated well, et cetera, et cetera. Or you would write like the vitals for patients you take back. you'd write like a basic chief complaint. Patient came into urgent care after tripping, obtained small laceration to left shin. You know what I mean? And that's it, pretty much. You'd send the chart to the provider and they would kind of finish out and close out the rest of the chart. So in an urgent care setting, it was very focus-based assessment on whatever brought them into the clinic. So charting is minimal.
What's the most common advice you give to your patients?
The most common advice I would give to my patients is, it depends, but like I know it's not the most common advice, but it's one of the last pieces of advice I gave to a patient at my job I just finished the other day. A patient had came in with their child, and the child was maybe like 11 years old, 10 years old. And, I asked him, what brings you into urgent care? I'm doing the normal spiel. And the parents said that the child had a temperature of 105.3 degrees the night before. And I said, 105? And they said, yes. And I said, no problem. And the child is not lethargic. The child is walking around, talking, explaining to me some of their symptoms. And I asked the parent, I said, what route did you take the temperature? And they told me the ear. And I said, okay, no problem. Did they take any medication today? They said, no. I said, okay, just, that thermometer, do you have it on you? They said, yes, I have it in my purse. I said, no problem. I'm just going to check your child's temperature now, just because if you ever see a temperature like that again, that's very, very, very high. So if you ever see a temperature like that on a thermometer again, you got to take him to the emergency room, right? Because that's a very high temperature, especially for like an 11-year-old child. That's crazy. So I checked the temperature orally and I got 101. And the parent, I said, you have the thermometer on you? Do you mind just rechecking it? Just because I feel like that thermometer might be out of calibration. And they rechecked it and the temperature was like 104. So my advice to them was just to make sure, throw that thermometer away right now and just make sure that, you have a good thermometer in the house and throw them away after a certain amount of time. It's important, if you have young children at home, you want to make sure you have good working thermometers, especially if your child is not feeling well. Because suppose that thermometer wasn't uncalibrated and the child's temperature was really that high, you got to make sure that you get them the care they need. You don't want that to become a medical emergency, which it could. So that was, they were very thankful for me for just make sure you check it. Let's check it again, because I don't think that thermometer is good. So they were very appreciative. And that's not the first time where a situation like that has happened.
What's been your most memorable patient encounter?
There was a patient that came in who was diabetic into the urgent care clinic I worked at. She was diabetic. And this was maybe, I don't know, maybe like a year and a half ago. Typically the process was if there's a patient that's unstable or needs to kind of be checked out in urgent care, that would be the charge nurse, which is an RN's job to kind of check it out, see what's going on, and ask the providers, does this person need to go to the hospital? Is this an appropriate place for them? And kind of escalate the care. If the patient had an insurance that we didn't accept, they have to check them as well, just to make sure okay, they have non-participating insurance before we say, no, we don't accept your insurance. The RN has to still check that patient just to make sure it's safe for them to, just to make sure we don't need to call 911 or anything. So the particular RN I was with that day, she was in the middle of dealing with something. I forgot what the case may be. And the front desk, they called twice. And they said, hey, there's a patient out here that has non-participating insurance. She's really not looking so good. And I said, you know what? I'm going to go out there and I'm just going to put her in the area. And then, when the RN is done, she can kind of take over the care. But I want her back here so we can keep eyes on her, even though it's the RN's, job to kind of triage and assess this patient. So as soon as I went out to the waiting room, I noticed she was in a wheelchair and she was kind of slumped and she didn't look good. So she was slurring her words and I immediately wheeled her in the back. And I said, what's going on? Are you okay? Talk to me. What's happening? I know we don't take your insurance, but tell me kind of what's going on. And she's slurring her words and I'm noticing she's diaphoretic. And I asked her, I'm like, are you diabetic? She said, yes. And I said, did you take your medicine? She told me, if I'm not mistaken, I think she said she took 33 units or 32 units of both a long acting and a fast acting about an hour and a half ago, prior to her coming into our clinic. And she was slurring her words. So she took maybe 60 something units of insulin in one shot because she said she ate a lot of candy last night And she thought she can kind of negate that. And immediately my heart sunk. And I quickly grabbed the glucometer. I did a finger stick on her, and her glucose was about 50. And she was hypoglycemic, extremely symptomatic. And, you know, I mentioned to the provider, and the RN was like finishing up her situation. I said, this patient is hypoglycemic. She has altered mental status. We need to call 911 for her. And I asked the provider for an order, and he said, okay, give her oral glucose. So I gave her the oral glucose. He came in, he assessed her, 911 was called. We shipped her out. And immediately I knew that was a medical emergency. So I was like, okay, I need to order. This is going on. You guys call 911. Let's get it going. And she started to become much more like, not, what's the word I'm looking for? Like she wasn't as obtunded and lethargic anymore, and started to become more talkative and looked a lot better presentation-wise after I gave her the oral glucose. And she was like, oh, thank you so much, sweetie. And like, you know what I mean? And that was a very memorable experience because I was so nervous, but I knew exactly what was going on without question. And I knew what to do. And I knew that I needed to just jump in and just take care of it. And it's like, hey, like, you know, I'm not going to stop rendering care. I'm going to handle this emergency, and you guys are going to, you know what I mean? So I felt very proud of myself in that moment.
As you should. What's been your most challenging patient encounter?
My most challenging patient encounter. There was a patient who was, I'm trying to think, like, give me 1 second. I'm trying to think, what is the most challenging? I think of a challenging encounter. Okay, so there was a patient that just didn't look well. And long story short, I'm pretty sure like the patient was super jaundiced, eyes yellow, huge ascites, really bad dependent edema, walking kind of on their tippy toes, and just didn't look right. And like I knew that that person needed further care than we could render. So I escalated it to the provider, and, you know, they sent them to the hospital. But the reason why I said this is the most difficult patient, or one of the more difficult patients, is because like the process is like, there's like a follow-up that usually like, you know, people in our clinic will do, where they have to call them and just say, hey, we sent you out to the emergency room. How are you feeling? How did things go? And this particular patient was a sweetheart. But they picked up and said, you know, that they're still in the hospital, which is expected. But they just sound like they had the wind kind of taken out of them. And in the clinic, they were so bubbly. And obviously they didn't realize like just how sick they were. We knew because we're like, this person looks terrible. Like, you know what I mean? There's so many different things going on. But I feel, without asking the patient, obviously, that their prognosis and the outcome might have not been very good. And that was very disheartening to just kind of hear the sharp contrast and like the wind taken out of that patient, and kind of reality setting in that, you know, they're a lot sicker than they anticipated, and things aren't looking so good for them. So that was pretty sad.
What's the toughest part of your job?
The toughest part of my job, I would say, is like when patients, the toughest part of my job, it's multifaceted. It could be a couple different things. I feel like something that makes it difficult sometimes is when, you know, patients, like I said previously, may not necessarily have the best outcome, or they're not doing so well, and you just kind of feel bad for them, right? You have no choice but to look at these people sometimes as like, they remind you of somebody, whether it's a family member or a friend, and you just kind of feel really sad for them when they don't necessarily get the best news, or, you know what I mean, the best outcomes. Like that's pretty sad. Or when I'm big on nursing education and educating patients and educating the public. Like I feel like that's important, right? So if somebody's non-compliant with medications, and I feel like there was not strong education as to why these medications need to be taken or what these medications do, and I can tell that the patient doesn't know and maybe they weren't educated, right? That frustrates me, right? You can't pick and choose when you take your Coumadin. You can't pick and choose if you're going to take your blood pressure medication or not. And I feel like sometimes patients will get put on certain medications, and it's like, okay, just take this, and that. And the person who prescribed it won't necessarily explain why they're ordering it or what the reason is, and they don't stress the importance of some of these imperative medications. And when I feel that the patient doesn't understand, that frustrates me. Or when I feel that, they're not taking it as serious as they should. And it's like, you can be on dialysis, like, your organs, like, this is a really big deal. Like, that makes me sad for them. And I feel like that's tough because you feel like you pour so much into the situation and you pour so much into caring for the patient. And you know what I mean? Like, it kind of takes the wind out of you a little bit.
So then what's the most rewarding part of your job?
The exact opposite. When, let's say, a patient will say what they take, what they have, know their history, and are able to articulate and explain, oh, I'm taking this and this is how you know what I mean? And they're really a champion and they empower themselves to be like a big part of their care. And they're really like an advocate for themselves. Like, I feel gratified when a patient's able to teach me things about their care or just about nursing or about in general, right? Their disease process. I love that. I've seen family members that can't, and it's really sad to see, so I think that's a very big part that makes me excited. Like, when a patient's like, yeah, I have this and I do this and I usually do this, and they're able to explain it and articulate it. Like, I feel really proud for them. And obviously caring for patients and kind of like being a positive part of their journey. Like, I feel gratified when patients thank me or when I kind of see things heading in the right direction. I feel like I'm doing something good.
What's your best clinical skill?
My clinical skill is that I'm very in tune with details and I pay attention to everything with a patient. I notice the most subtlest things that go on and I make note of it. There was a situation that happened at my capstone clinical as a student where there was a pillow. You know what? No, we're not going to talk about that. But I noticed something was different than it should have been, right? And I escalated that to the nurse, and long story short, I was right. And it was a very subtle thing for someone to pay attention to. But again, I'm kind of assessing every aspect of the patient. I'm doing a general assessment. I'm looking at their bed. I'm looking at what they have in their hands. I'm looking at what kind of phone they have. I'm really assessing the situation. And in me being so focused on details, it was something subtle, but I was right. And I felt like, wow, like, because I'm a student and also because I'm a newer nurse, I have the lens, a newer RN, I have the lens of looking at things and not being so, like my eyes are fresh, right? So I'm paying attention to everything. And I use that. I think that that's honestly like a strong skill and almost like a superpower to be so focused and so.
Mm-hmm. Who are you most grateful for on your care team?
I'm grateful for like other more seasoned nurses that are willing to answer questions and are willing to kind of explain things to me. The people that are in your care team that you notice that are, able to answer these questions and are willing to let you ask them questions and explain things to you, even sometime without you asking, those people you really got to hold on to and just, suck everything they say. Like, I feel that's important because it's so unfortunate. Sometimes they say like nurses eat their young, and it's true in some cases. Like, there are nurses that don't want to help out their colleagues. You know what I mean? Certain providers, they don't respect your opinion. They expect you to, you know what I mean? So I feel like if you find a point of contact that's willing to answer questions and let you ask them things, that's golden.
Do your friends or family ask you medical random advice?
Sometime, yeah. Definitely.
Do you give unsolicited medical advice?
Sometime. Only if they tell me something crazy and I have to let them know about themselves.
So this is perfect because you have a new job coming up. Do you ever get nervous or anxious? And if so, how do you manage those feelings?
I get nervous and anxious often in like big social settings where there's a lot of people. I smile. I have this weird thing where sometimes I nervous laugh. But I just kind of like, you just kind of roll with the punches. Like I accept that that's my little weird little tics, and it is what it is. You know what I mean? And it's going to get better. You just got to kind of remind yourself it's natural to feel this way. And this is just part of the journey. And, you know, it's good that you feel that, because if you feel a sense of anxiousness or a sense of nervousness about a brand new situation or something going on, then that means you're like hyper vigilant, right? And you're paying attention and you're careful and you're doing things with purpose. So I feel like that can almost be something to empower you when you have that feeling of like nervousness, anxiousness, because you're more detail oriented and you're cautious.
How do you avoid or manage burnout?
To manage and avoid burnout, I feel it's important to try to like figure out what makes you feel relaxed or makes you feel good and tap into that. On days when you're not working, you got to practice self-care, whether that's going to the gym or going to a spa or just getting your nails done, getting your hair done, like sleep patterns, like whatever you do to decompress yourself, you got to do it. And you got to spoil yourself. You know what I mean? You work hard and you take care of people all the time as a nurse. You got to take care of yourself, and don't be afraid to buy yourself a nice bag, or don't be afraid to spend a little bit of extra money on a little shopping spree. Like, don't be afraid to do it. If it makes you feel good, then do it.
So that's perfect. What are your hobbies outside of practice?
So outside of practice, hobbies, I don't have many hobbies, but I definitely do enjoy like doing creative kind of things. Like I recently was like tie dyeing some clothes and it was like fun, or like going on Pinterest and finding like little crafts to do. That's fun. I enjoy doing that. Or like going to, like I went to the spa a couple days ago. That was pretty cool. Just doing little things to kind of relax my mind, relax my, you know what I mean? Feels good. And I've been really into like skincare and like a nighttime routine of like trying out products and stuff like that and just kind of like pampering myself. I feel like that's important as well too.
And so is that how you spend your days off?
My days off, it depends. I try to do as little bit as possible. I mean, obviously you're going to like do things like chores and, you know, take care of your household because you work odd hours, you work long hours at night and et cetera, et cetera. But I definitely do devote like at least one of those days. Like, okay, I'm going to go kart riding with some friends, or I'm going to go out to a restaurant with a couple, you know what I mean? You got to just do whatever feels good, and you got to devote the time throughout the week to just kind of decompress.
We're hanging out for the day. What's on the agenda?
What's on the agenda? So we're hanging out for the day. It's New York. I feel like when you're in New York, you got to go to Manhattan or go to Queens and just like grab a bite to eat, maybe go to Central Park, just enjoy nature, enjoy food, shop, just be out and enjoy the city, right? I feel like you have to when you're near the city, right? You go to Brooklyn, you go to Red Hook and just like grab some food and just kind of walk along the pier. Like, I think you just got to kind of like have fun, right? And enjoy the city, enjoy nature, enjoy the city, not nature, but just enjoy the city views. There's nothing to do in Westchester. Westchester's boring. So you got to go down to the city a little bit.
How many hours of sleep do you get on average?
This week I'm transitioning between old job and new job. So I've been sleeping like a lot, but on days when we're still working and, you know, next week I'm going to be starting full-time work again, I would say on average, it was probably closer to maybe like 6, 7.
Still pretty good.
Mm-hmm.
When does your day typically start and end, especially like the last 6 months in particular?
Mm-hmm. On days I would condense my school schedule. So I would try to I would have my lectures on Mondays, right? And Mondays were like the worst day ever because I had an 8 a.m. class on Monday morning. And then my next class would be at 5 o'clock. And, you know, my school was in Long Island. I live in Westchester. It's far, right? So I would just be at the school for hours and hours and hours studying. So Mondays was like the worst day ever. But then like on days I would get up at maybe like 6, you know, in the morning for, you know, going to work. I had to be to work by like 8 o'clock roughly. And I would just like start getting my mind right, waking up, okay, it's time for work. And I would do like a 12-hour shift, basically like 8A to 8P pretty much at the clinic. And yeah, that would be the days I would either be at school or at work. And then on the days I had capstone, I was 7P to 7A. So that was tricky to kind of like flip my sleep schedule like that. So I would oftentimes like kind of try to stay up and then like go to bed like really late so that way I can wake up later to go to the hospital to bang out a 12-hour night shift. So the past 6 months was tricky, kind of balancing those three like different schedules, different, sleep patterns. Like that was tricky, but I'm just glad it's over. I need some type of continuity and consistency in my schedule again.
I hear that. What's one bad habit you should stop?
One bad habit I know I should stop. I'm a stress eater, and like when I get really stressed, I'll like go or like something I have no business eating. So that I'm working on that, but that's definitely like 100% my bad habit.
One thing you're afraid of?
I'm afraid of failure, and I'm afraid of letting myself down.
Coffee, tea, or soda?
Coffee. I'm a big coffee girl. Like I love coffee. Iced coffee, like hot coffee, like espresso lattes. Like I'm a big coffee girl.
Scrubs or no scrubs?
Scrubs. I love scrubs. Like it's so funny because like all the new like young girlies, like because I went to school with people that were like fresh out of high school, like 20 years old, right? And here I am, the old 29-year-old, like ancient. So they would always be like, oh, we got to get some fig scrubs and want like, the really tight joggers and fitted scrubs. And I don't know, maybe I'm a grandma, but like the old school, like Cherokee boxy scrubs that feel like pajamas, I go crazy for those, right? Like it feels so good just to like slip on something that feels super comfortable. And it's like you're running around for 12 hours. Those with like a good pair of sneakers, you are so comfortable. Like I'm all for comfort rather than fashion. So like scrubs, and not the tight scrubs where, if you just ate something like bad for lunch, like they see your little food baby. I want like some loose, comfy scrubs that feel like pajamas.
If you had one more hour in the day, what would you do with it?
If I had one more hour in a day, I would focus on like my mental health and mental wellness. I would try like to meditate more and try to kind of like relax my mind and my spirit.
That's perfect for this next question. What is your advice for others or advice for yourself when it comes to managing your mental health?
My advice would be to understand that it's okay not to be okay, and know that, sometimes we need to feel these feelings and we need to experience it and kind of like move past it, right? You can't subside and hide and push away feelings and try not to experience things or feel things a certain way, because that's how you kind of explode, or that's how, you know what I mean? So I feel like if you feel anxious or you feel really sad about something, let it out, right? Let it out, get through it so you can move on, and recognize when you need a break or you just need to kind of decompress. You got to acknowledge these feelings, because if you don't, they'll acknowledge you and it won't be good.
And this is advice for others or for yourself?
For everybody.
What did you think you were going to do when you were a kid?
When I was a kid, I mean, I honestly remember being like in 6th grade in middle school and saying I wanted to be a nurse. I really remember that. But at one point in time, I remember being like in the 3rd grade, and like we did this little activity as a class, and like somehow, some way, we like were practicing careers or something, and I got journalist, and I was like, that's interesting. So like for like a week, I thought I was going to be a journalist when I would like watch my mom watch the news.
What advice would you give your younger self?
The advice I would give my younger self is to be patient and know that your time is coming. You're great. You don't doubt yourself. Just know that, you know what I mean? Everything is going to make sense at some point. You just got to give it time.
What would you do if you could do it for free?
If I could do it for free, what do you mean?
What would you do nursing for free?
Not in 2024.
Something you love so much that we don't have to pay you to do it.
Something I love so much that you don't have to pay me to do it. Having conversations with like older people, like listening to older people kind of explain and like just give me like life advice. Like I can sit there and absorb what they have to say all day, every day.
Okay. What can we expect from you in the next 12 months?
In the next 12 months, I'm going to take over the world.
Oh, okay.
I'm just kidding. I'm totally kidding. In the next 12 months, you can expect me to just be the best me I can be and be a sponge and absorb as much and kind of grow into my craft and grow into the position of being a SICU nurse and what that means. And, you know, just be humble and expect growth.
The best advice you can give others that you should take yourself.
The best advice I can give others that I could take myself. Somebody told me this recently about myself, and it was like, poof, like aha moment when they explained this to me. They said that I got to learn to give grace, and I can't expect, like, the way you think, you have no choice. And I'm an only child, so I don't know if this has to do with that, but like, I can't expect everyone to think the same way I think or feel the same way I feel, or to have their mind made up about something as fast as I do, right? So when someone is kind of teeter-tottering on an opinion or just they're not sure, or, you know, I feel like it should be obvious about something, I got to expect that, like, not everyone is the same in that way. Some people have to ponder on things for a minute and kind of, you know, and I got to give grace when that happens. And just, you know, I can't be frustrated with just the process of not coming to the same conclusion, if that makes sense. And I was like, okay, that's fair.
The best 3 decisions you've ever made?
The best decision I ever made?
The best 3 decisions you've ever
Best
made?
3 decisions I've ever made. Going back to school at 25. That's one. Moving out of my mom's house. I can't think of the third decision that, you know, I'll leave it.
Agreeing to come on this podcast.
Agreeing to come on this podcast, yeah.
Tell your story, inspire a generation. What about the next 3 decisions that you need to make? What are those?
Figure out what I want to do within, like, the context of going back to school, right? Because I know definitively I want to go back to school. I just really got to, like, figure out what angle works best for me and what's going to have me with, like, the most long-term, like, you know, satisfaction. So that's one decision. I want to become better with financial literacy and, like, just improve, like, you know, my financial, like, savings and things like that, and just kind of, like, build assets. Let's see. And I don't know, just I want to get CCRN certified and possibly TCAR certified. So, like, additional certifications to go with my RN license is definitely something that I need to do as well.
Okay, we've arrived at our final question. This is an opportunity for you to think about and share what you want your legacy to be.
I want my legacy to be that of someone with compassion and someone who will go to bat for you and advocate for you. But more than anything too, I used to not think that I was that smart, right? In high school, I almost didn't graduate. Like, I remember, and it wasn't that I wasn't smart. It's just that I didn't know the type of student I was. And me not realizing my potential or the type of learning style I had kind of, like, affected me negatively, and kind of like delayed, right? Me being like, I'm 29 and just getting my bachelor's now. So I feel like I want people to respect my brain, right? Because like for the longest time I didn't respect it, and I didn't appreciate the knowledge I have, or just how much I knew or what I could do, right? So I feel like if they say Shydai was really smart and she was a deep thinker and she knew a lot, like that's the biggest compliment you can give me.
Well, Shydai, we cannot thank you enough for coming on this show and sharing your insight, your perspective, and your vision for the future. But most importantly, I'm just so proud of you and your journey. And I love the fact that you have come on here to elevate the voice of LPNs and even CNAs who truly don't get enough attention. And we hope we can change that. And we're hoping to change that with your story.
Thank you. Thank you so much. Thank you for having me. This was fantastic.
You're fantastic. Thank you.
Bye.